Hello, everyone. Thanks for coming to our webinar about the COVID-19 vaccine, answering all of your questions about the vaccines that our employees submitted through our survey, and any other questions you might have about the COVID-19 pandemic. So we have our one of our physicians, Dr. Duha Azulbadi, is here, as well as Patrick Hogan, who are going to walk us through some slides to talk about our survey results and share more information about the vaccine.
All right, so thank you all for joining us today. There's a special thanks from the Infection Control Committee and the Infection Prevention Team for doing all the hard work that has been done in this tough year. The slides today are going to be heavy with information. We are going to talk mainly about the vaccine. The goal of our presentation is to really empower you, empower all our healthcare workers at Rankin Jordan with answers to the questions that have been brought to our attention with a survey. And so let's get started. And so we are at or are near some incredibly sobering milestones, approaching about 100 million confirmed cases of COVID-19 worldwide and over 2 million deaths in the whole world. This has been one of the largest pandemic that the world has ever seen. If we move to the data in the United States, we have just passed 400,000 dead Americans in 10 months. That means more than 1 in every 1,000 Americans is dead. If you can look at the graph, which will probably be very similar to the one that we're going to see in Missouri, the cases really, we hit the second surge right after October. So right after Halloween, we started to see the highest surge, even more than the one we've seen in April. There are currently 2,400 people hospitalized with COVID-19 related illness in Missouri. And so this is a high number. We've probably become numb to the numbers. In the last month or so, we are seeing lower hospitalization, but still the numbers are pretty high and concerning. If we want to focus about Rankin Jordan, and what we have experienced during this pandemic, we've had 0 patients up until just last week. Last week, we've had 1 patient testing positive for COVID-19 after 1 week of hospitalization. We also instituted contact tracing that we don't think found any relation or transmission from patient to patient. And the families or visitors were also negative for COVID. So we are expecting that this was a nosocomial or COVID-19 acquired infection at Rankin Jordan, our first one. So we've done really, really well, and it is expected to have an infection, but we really want to do better. If you want to look at the dashboard and look at the employee numbers, we've investigated about 50% of employees. What I mean by that is we've had about 223 employees present with exposures that are consistent with COVID-19. Out of all of those, 52 tested positive, which is about 11.5%. This is consistent with almost all hospitals in terms of employee data, but still it's a high number. And hopefully this number will go down with vaccination. So there are about 9 approved vaccines so far in the world, 54 in development stages with 8 more in phase 3. That's pretty exciting. There are only 2 COVID-19 vaccines that are currently being used in America and approved. They are the Pfizer vaccine and Moderna. They're both messenger RNA vaccines, which we will talk about in a little bit. They are being given in phases based on risk of contracting COVID-19, and both need to be given in 2 doses. The Pfizer vaccine is given every 3 weeks, and the Moderna is every 4 weeks. So far, over 16 million people in the US have received at least one dose of vaccine. There are several vaccines that are going to be approved hopefully soon, um, but we will focus on mRNA vaccines today. So, how does this messenger RNA vaccine work? So, this vaccine is the protein that comprises the virus that we're interested in. It's that protein that sits on the surface of the virus. It's called the spike protein. It actually looks like spikes. And that's the protein that's responsible for attaching the virus to cells. But if you can prevent the virus from attaching to cells, you can prevent the virus from infecting cells. So we also know the gene that makes that protein, the gene is called messenger RNA. The messenger RNA is the gene that eventually is translated to become a protein. So we all have messenger RNA in our body because we make proteins all the time, and usually the messenger RNA, after it makes that protein, degrades relatively rapidly. So you won't have residual mRNA in your body that's floating around from this vaccine. Hopefully you'll have the product of that mRNA. So the way this is going to work is that the messenger RNA vaccines it's the mRNA that codes for that coronavirus spike protein. You're inoculated with that small little piece of genetic material. That genetic material then enters your cell and is translated into a protein. In this case, the coronavirus spike protein, which is then excreted from the cell. So in essence, your body makes the spike protein, and then your body makes antibodies to the spike protein, all because it's been instructed to do so. Your cells have been instructed to do that by this little piece of messenger RNA. So vaccine allocation from the state and the distribution did not allow us to vaccinate our staff at Rankin Jordan, but we have reached out, and Mercy has generously allocated some of their vaccine supply to our staff. So far, we've had 214 employees receiving the vaccine, the Pfizer vaccine. And that's about 60 to 70% of our employees, and 60 who are in the queue to receive them next week. We have unfortunately a few who declined, and we're working on educating them. There are about 90 employees and about 50 people who have not really responded whether they want to take it or not. So we're still hopeful that with education and continuously reaching out that we will have all our employees get the vaccine. In terms of side effects at Rankin Jordan that we've seen so far, we've had 0 anaphylactic reactions, which is super exciting since this has been one of the things that have been very evident on social media, but we have had 0 anaphylactic reactions. We've had 7 employees, which is 3%, report side effects that did not allow them to come to work. This is data from the first dose. The second dose is probably going to be a little bit higher, just given that the second dose can have higher side effects. So really the distribution and the hesitancy of taking the vaccine can be overcome by influencers. So we are really asking all the healthcare workers and all employees of Rankin Jordan who are offered and decided to believe in science and take the vaccine to influence the public, which is going to be our really big step coming up to go back to normal. Really proud of our medical team department where they had 100% vaccination. When you ask them why some of their codes have been, they want to protect themselves, their colleagues, their patients, and their loved ones. They really want to end this pandemic and go back to normal life. They are asking you to trust in science and take the vaccine. Hand it off to Patrick to go over the vaccine that we did at Rankin Jordan and explain the data.
Yeah, so we want to thank everyone who participated. We sent out a survey in the week following everyone being offered the vaccine, and 231 of our employees actually responded to the survey, and it was kind of a cross-section of the same numbers that we saw, as far as about 70% of the people who responded took the vaccine, and there were 50 people who responded that didn't take the vaccine. And those really were the people we were most interested in hearing from, because it's really important for us to understand people's motivations and fears, and then give us their questions. We got a lot of fantastic questions, and that's what we're going to try to talk about in the rest of these slides. So there were some demographic differences in the types of people who did and didn't take the vaccine. So employees that were less likely to accept were younger, female, and African American, and some roles were less likely to accept the vaccine. So nursing, pharmacy, and facilities, compared to some of the other departments like the medical team that Dr. Duha just mentioned. So we asked people to tell us what their reasons were for declining, and they could select from a long list, and they could select more than one if they wanted. And the ones that kind of came up the most were these 5. So about 60% of people were really concerned about long-term safety, as well as that the vaccine might have been developed too quickly. Lesser, but still the next 3 most common were doubting the effectiveness of the vaccine, which is where we'll start on the next slide, lacking knowledge about the vaccine, and then there were a good chunk of people who worried about pregnancy, breastfeeding, and fertility issues. So we asked these 3, we made these 3 statements and asked people to respond their level of agreement. So we first wanted to know, are you concerned about getting COVID-19 disease? Are you confident that the vaccine is safe? And are you confident the vaccine is effective? And then what these graphs show you are the distributions of those 2 things, depending on if people were acceptors or decliners of the vaccine. And you can see that across all 3 of these statements, acceptors and decliners felt very differently. So as far as being concerned about the disease, that completely agree, up in the top left corner, quite different. People that declined just weren't quite as concerned, but most importantly, those who declined were way less likely to consider the vaccine safe and effective. And we also asked a further question of those 50 people who declined, and we said, do you plan on taking this vaccine in the future? And about half of them said yes. And so when we looked more closely into those 50 people, the people who were more likely to consider the vaccine safe and effective, the people who were more likely to take the vaccine in the future were more likely to think it was safe and effective. And that the reason they really were declining was due to pregnancy, breastfeeding issues. And then the people who really were probably never going to take the vaccine, or at least that's how they feel right now, they were more likely to think the vaccine was not safe and effective, and were kind of more concerned with long-term safety and speed of development. So the first thing we want to talk about is, is this vaccine effective? And Dr. Nick says it is, and so we have some data to back him up. So, because obviously that's the first thing. We need to make sure it works if we're going to all take this vaccine. And so if you combine the results of these 2 main trials that Duha has been talking about, the Moderna and the Pfizer trials, there are 74,000 participants across those 2 trials. Half of the people received placebo and half of them received the vaccine. And when followed for 4 months afterwards, there were 366 cases of confirmed COVID between combined of all those 74,000 participants. When you look at which group they were in, 347 of those cases were in that placebo group, so people who did not get vaccine. Only 19 of the people who got vaccine had a confirmed case of COVID. So that's the 95% effective number you've been seeing, and you can see it displayed here in this graph as well, if that's easier for you. So it's really impossible to overstate how important that is and how impressive that is, and how far that surpasses expectations of everyone involved in development of these vaccines. And then almost as important, or maybe more important, in addition to being 95% effective, the vaccine was almost 100% effective at preventing severe disease. So only 1 person in the vaccine group got a severe case of COVID. And thinking about, what Dr. Duha mentioned with 400,000 dead Americans, we can extrapolate this data and say if all of the people that died had been able to have this vaccine back, if this existed back in January when COVID came up and we had this preventive measure, at that 95% effective rate, 380,000 of those people would never have gotten COVID, and almost all of them would be alive today. So the next biggest question that people had was the vaccine made too quickly? And we, of course, have to agree that it was made quickly. So we just want people to think maybe, this is a remarkable achievement that it was made so quickly and not really a cause for concern. And there's a lot of reasons why it was able to be made so quickly. So I'll kind of spend some time here and go through each one of these. So first, we had a major head start as far as making this vaccine. So a lot of the legwork for the vaccine was started in the 1990s. mRNA vaccine tech has been going on since then. And there were some genetically similar viruses that we started making vaccines for, and then as those epidemics faded, the funding and the focus faded, and those vaccines never came to fruition. But that gave us the head start that we needed to get this one going quickly. And then probably as importantly is the funding. So there was an unprecedented level of funding pushed towards this vaccine from both private and government agencies. And so typically some of that funding is hard to secure quickly, and you have to apply and then wait, and approvals drag on forever. But that's because priorities are diverse, and during a pandemic like this, the priorities were not diverse. Everyone was focused on one thing: we have to end this pandemic. And so just money was not really in the way like it can normally be. Production also was would normally be a major hindrance, but because this was so important, manufacturers took big risks, and they actually started producing the vaccines that they had in their trials before they were approved, kind of with the hope that once all the safety data was looked at and the effectiveness data, that assuming that things looked good, they would be ready to go on day one and be able to start getting shots in people's arms. Collaboration was another big thing. We had government agencies, academia, nonprofit organizations, pharmaceutical companies, hundreds of thousands of study volunteers, and more working to just get this done as quickly as possible. The 75,000 participants can't be overstated in those two trials, and then all the other vaccines going on right now with even more participants. Often we do not even get that many vaccine study participants, even when studies go on for 3 years. For instance, the shingles vaccine had 15,000 participants. This pneumococcal vaccine, Prevnar, had 37,000 participants. And both of those vaccines took longer to make, but they didn't necessarily have more people being studied. There's also been major tech advancements in RNA biology, chemistry, delivery systems, and manufacturing when compared to prior vaccines. And so, we see technological advancements in our lives with cell phones and TVs and don't think anything of it being too fast. But with vaccines, it makes people nervous, and really scientific technology is no different. And then finally, the bureaucracy was expedited. So a lot of these big waiting periods that happen between steps and just delays, and we'll talk about that in the future. All those sorts of things were compressed, and people always were ready to analyze data and to talk about safety and to get all those conversations happening quickly so that we can move on to the next step. So in summary, we didn't sacrifice scientific standards or integrity of the review process or safety in order to get this done quickly. So that long-term safety was also probably top of people's minds of those who didn't want to get the vaccine. And so we, of course, need to point out that no vaccine, or really medicine in general, is 100% safe. And that we obviously only had months, not years, of data follow-up. But in the past, long-term effects usually happen for vaccines within about 40 days. And that EUA, that emergency use authorization that was granted, didn't happen until 60 days after the second dose. So we really have had the time to look and see, what are these effects that could possibly happen. And these effects are very rare with vaccines, and we don't expect to see them with this vaccine. And this is like a really important time to talk about, if you're worried about long-term consequences, we should think about long-term consequences of COVID, not just the vaccine, but of the disease. And we kind of know what those are already. People get heart failure and lung disease and COVID fog, and just are dealing with issues for months and months, and who knows how long those will go on. And So thinking about no long-term effects seen yet from the vaccine versus those long-term effects. That's the risk-benefit analysis you have to make. And then what we do know about the vaccine that makes us pretty sure there won't be long-term effects. So that first, it's simple ingredients. There's 7 or 8 ingredients in each of these. There's the mRNA, and then there's some lipids, which are used to help transport that mRNA, which is very fragile and would just kind of get eaten up by your body if it wasn't for those lipids. And so there's really not much to what they put inside of you. This drug cannot alter your DNA. There's no live virus in the vaccine. You can't get COVID from it, and it doesn't even enter the nucleus of your cells. So all that in mind, we also need to talk about short-term side effects. So we must be honest here, there are some short-term side effects of getting these vaccines that are relatively common. So a lot of people have sore arms, others have headaches, body aches, chills, or fever. These things are more likely after the second dose. I had my second dose yesterday, and I'm here to give this talk. So most of these things occur within 24 hours, and then you feel great, and you know you're going to be protected. These reactions are honestly a very good thing. It means your immune system is working, and the monitoring of these adverse events is being taken very seriously. So we are forced to have this 15-minute waiting period after we get the vaccine. Anyone who gets vaccines has to have EpiPens ready and be ready to jump into action if anything does happen, as rare as it is. And then there's these vaccine monitoring system, VAERS, and the vSafe app that you can download on your phone. And people are tracking what's happening, and if they start to see certain reactions happening more or too often, they would put a stop to vaccination if they thought it was in the best interest of the public. So luckily in the survey, not too many of these rumors and conspiracies that we hear about on social media and sometimes in the news came up in that survey, but we did want to bring them up because we know that some of you might have some of these in the back of your mind. And so we just wanted to kind of bluntly point out some things. There's no chip or tracking device in this vaccine. Bill Gates is not collecting your data. COVID and the vaccine are not a hoax, and COVID and 5G have absolutely nothing to do with one another. It's very unfortunate that these things have to be stated. This screenshot comes from the Missouri Department of Health, the covidvaccine.mo.gov facts, and you can go there and find out more information about a lot of these rumors. But just if you do hear these or think about spreading them or come in contact with people who like to talk about them, just try to remember who's telling you this information, where are you getting it, and is that how would that conflict with what trusted members of the medical community say about the vaccine? So try to think to ask a medical team member at Rankin Jordan, or ask your doctor, or go to websites like the Missouri Department of Health or the CDC before you listen to what you might hear on YouTube or Twitter. I'm gonna hand it back to Duha about allergies.
Okay, we get asked this question a lot, which really is, what if I have allergies to vaccines, allergies to food? And the answer is that the CDC said that the absolute contraindication to these vaccines is only a known hypersensitivity to COVID-19 vaccine. So even if you had a reaction to influenza, it's indicated that you get the COVID-19 vaccine, but you are just going to have to be monitored for longer. Most or all of the reactions that have been reported to the CDC, the anaphylactic reactions, happen within the 30-minute window. And where an epinephrine worked and all the other measures worked, there were no deaths from these anaphylactic reactions. So these are, I think, important things to note. Do not get the vaccine if you had a reaction to your first dose, or if you know that you are allergic to the polyethylene glycol, which is a component of the vaccine. So the CDC has collected data on all the vaccines. They've published data last week about the 100.9 million first doses that were given, and only 21 cases of anaphylaxis occurred. That's less than what the anaphylaxis can occur if you take a penicillin dose in terms of incidence. Like I said, no one from Rankin Jordan had an anaphylactic reaction that we know of. And if you're already monitored for 15 minutes, and if you have any concerns or have other reactions, they may ask you to stay for 30 minutes. Another question or concern we have is about pregnancy and breastfeeding women. I think, to be honest and clear, those trials did not enroll pregnant women. They were not, the vaccine was not given to them if they were pregnant, but we have data that some women who were in the trial became pregnant during that time they were in trial. The number is small, and so scientific data and conclusions have not been released. There are ongoing data on pregnant women who decided to receive the vaccine. There's really no scientific reason why mRNA vaccines would be harmful to the mother during pregnancy, the development of the fetus, or to a breastfeeding infant, or a cause of infertility. What we know is that COVID-19 can be fatal in women who are pregnant, and they are considered high-risk population. And so I think if you are pregnant or breastfeeding, the best thing is to actually look at your risk and discuss your risk with your OB. And I've seen a lot of OBs really help their patients taking the decision. It really depends on your risk of exposure. So if you're pregnant and you are able to quarantine at home and limit your social interactions, it may be wise to just wait and wait for further data on pregnant women. But if you are exposed, taking care of COVID-19 patients, you may decide to take the COVID-19 vaccine to protect yourself from the actual disease. So the current question of, can vaccinated people spread COVID-19? Most scientists say or believe that it's probably unlikely. Just thinking about vaccines prevent infection, and so if they're preventing severe infection, they're most likely to present asymptomatic or mild infection. That means you're not going to have a high viral load or virus to spread to others, and that's how you spread the COVID-19. And so I think that we don't know the answer, especially Pfizer did not collect samples or have any data on asymptomatic infection. The Moderna vaccine trial suggests that the vaccine has a protective effect in preventing asymptomatic infection, but we don't know for sure. I think until we know more, until there's more data, until the CDC releases some more information, we just have to continue the measures and have to continue physical distancing, masking, avoiding crowded indoor settings, and regular hand washing. How long does my immunity last? So the question about how long does your immunity last from acute or natural COVID-19 disease has been studied multiple times. There are reports of recurrent or reinfection after 90 days, and that means that your antibodies have weaned or you're no longer protected. There are more studies coming out that maybe your protection is longer. It could be for 120 days, 155 and longer. So we don't really know. It's really a pretty new disease. The data is coming out quickly. We don't know the exact timeline. There's speculations that you are going to be protected for at least 8 months. That's what your natural infection does, and so, or you could be protected for more. So I think for people who took the COVID-19 vaccine are probably having higher antibody response compared to the natural infection, and that's been studied and is continuously been proven. And so this is my least favorite topic. Will the vaccine protect against new variants? I think the bottom line, again, this is very new data. These are very new variants that we don't know a lot about. But what we know is that they are more transmissible. They're not more deadly. We just have more cases because of those new variants. There are some studies that are showing cross-reactivity or cross-protection for these new variants. And the antibody response that we have seen from COVID-19 vaccine, at least for now, is shown to be broad. Even in the presence of certain protein substitutions like this new variant, most scientists believe that it should hopefully neutralize the virus. And remember, it's not only your antibody response when you take the vaccine, there's also the memory cells and the T cells that are probably also acting and helping in preventing or getting an immune response to this new variant.
So some of our employees and other people out there might be wondering if they already had COVID, should I get vaccinated? And then when? So the answer is yes, you should definitely still get vaccinated, and it's just a question of timing. So first, we don't want you going to get vaccinated while you're having an active infection. So once your active infection is over, it is technically safe to get vaccinated. It's just highly unlikely that someone who had a COVID diagnosis would be reinfected within those first 90 days. And so vaccine prioritization is being given to people who don't already have that natural immunity. But after 90 days, it's a smart idea to go get your vaccine just in case you're one of the people who had a smaller immune response and will be less protected in the future. People are wondering when the rest of us will get vaccinated. So some people that just didn't get on that initial list. And so Mercy is currently working with us to get the rest of our employees vaccinated, those that were on the wait list. We've also applied for our own allotment of vaccine from the state. So we just don't know when it's coming. We've been assured that it's coming at some point, but as is with all of the stuff with vaccines, we just don't have a ton of information, and the information changes quickly about how many are available and how many you're going to get. So we don't know when that's coming, but hopefully we'll be able to vaccinate new employees and volunteers and maybe even some of our older patients once we do get those vaccines. And then you're more than welcome to go and sign up on your own elsewhere. So there's a lot of websites that we have kind of compiled here for you, different hospitals and health departments that have places where you can get your name on a list. And we definitely think for healthcare workers, we have this time right now where we are the top priority for everybody to get vaccinated. So we think it's important that you use that time now while they're kind of holding the vaccine back from everybody else to get your vaccine. But if you don't, you can get on one of these lists. You can share this with your family and get them on these lists. And when it's their turn, they'll get called back. And you can get on as many of these lists as you want. You don't have to just do one, and there's no harm. And you just tell them you don't need it if somebody calls you or emails you. There's some questions that we just don't really have answers to. So when can we take the masks off? Will the vaccine be annual? Will masks be seasonal? I don't think any of us know. We're hoping Dr. Fauci predicts masks can maybe start to come off in the fall or the end of this year, but that's really dependent on how many people take the vaccine and how many vaccines are available. So I guess we'll all wait and find out these things together. So in summary, we want to just remind everyone that vaccines don't save lives. Vaccinations do. So you really need to get the shot in your arm if you want to have the full protection. And this protection from the vaccine is the most effective tool you have to protect not just yourself, but the people you love, and to bring this pandemic to an end. So we just want to remind you some recommendations while we're waiting for this vaccine to work, and know that there's hope. We need to stay vigilant. Still don't come to work when you're sick. Maintain distance and continue to wear those masks and wash your hands. So Dr. Duha and I wanted to tell you that we're always here to talk. If you have questions or about the vaccine or anything else, this is what we look like, and you can reach out to us at our phones or emails, or just stop us in the hall. We just wanted to share with you some of the places we got this information, and thank you for listening to our talk.
This was a lot of information, incredibly helpful. We did get some questions through the chat during the presentation, so I wanted to go ahead and ask you those, so if you could share some answers. So I know we talked a little bit about pregnant women and the vaccine, and it's okay if we don't have a lot of information to share, but is there any data that shows for anyone who received the vaccine while pregnant, how was their child after birth? Did the child have any effects? Because we focus a lot on the mom, oh, we're fine, stay protected, etc. Any information on the child?
Muted, Duha.
That's a good question. Thanks, Valerie. We really don't have enough information about pregnant women. Like I said, they were not enrolled in the studies. There are numbers of pregnant women who were in the studies who did not report any complications, whether during pregnancy or at birth or in their child. So the number is low to make conclusions. One thing to note, though, is that there are no reports of infants having congenital abnormalities after COVID-19 infection by the mother. So there's still a lot for us to learn about infants, but we don't have enough information.
Okay, got it. What are some things we can do to prepare for the vaccine itself? So you talked about how there might be some side effects. Is there any information or anything we should do to kind of prepare for those?
Yeah, good question too. So the first dose is reportedly less side effects after the first dose. So most people have a sore arm, maybe fever, chills. We as medical people do not recommend taking Tylenol or Motrin prior to the vaccine, but definitely taking those like Tylenol and ibuprofen after your shot is definitely helpful. For me, the second shot was very remarkably worse than my first vaccine. Really heavy sore arm, chills, and bone pain. And so I think, with Tylenol and Motrin, within 2 to 3 days, you'll feel completely back to normal. And it's actually a good thing, like you mentioned, and it just is definitely worth it to prevent a true natural infection.
Yeah, I took 2 Advil this morning, the morning after my second dose, and I'm just a little tired today, but that's about it for me. So definitely worth it.
Great. So you talked a little bit about the likelihood. We just wanted to make sure we were understanding this number correctly. So the likelihood of getting COVID after both doses is less than 5%. So 95% effective. So essentially, what's the likelihood of me getting it after my second dose?
So the trials showed that you are 94% to 95% protected really after 7 days of that. Of taking your second dose. So there is a chance that you would get COVID-19. It's dramatically less compared to any other vaccine. So for example, flu doesn't protect you as much as COVID-19, and all the other. This is one of the most effective vaccines. It's truly amazing science. And I think at some point after this pandemic is over, probably those mRNA vaccines really have gained or deserve a Nobel Prize.
Great. So kind of talking about life afterwards. So, if I'm vaccinated, both times fully vaccinated, is it safe to see my grandkids? What will life be like after? What's okay to do? What's not okay to do?
I think still, this is one of those questions that's tough to answer, but I think we're still trying to say, don't make any drastic changes to the way that you've been behaving. For the time being, there's just not enough people vaccinated. We still have that kind of small chance out there that you could still spread the disease, even if you didn't get sick. And so, even though that's unlikely, it's just safer to keep up with the physical distancing and the masking, especially because you don't know who else has had the vaccine, or we don't want to kind of relax any of those rules and then have people who didn't get protected try to take advantage. So I think for now we're saying keep doing what you're doing, and hopefully it won't be for very much longer.
Okay. that is all of our questions, and we'll share this information as well as some of the links to the information, the other FAQs you provided, as well as other ways people can register for the vaccine on their own or share with their family and friends on how they can register online for the vaccine too. Thanks.
Thank you.
Thank you.